I really distilled what I think are the top 10 pieces of parenting advice that I give to parents when I meet them at the NIH. I meet a lot of parents who are coming when their child first has a newly rare diagnosis given to them, and they have a lot of questions. I meet kids who come recurrently, lots of kids with primary immune deficiencies. So I'm trained as a pediatrician and a psychiatrist and a child psychiatrist, and my interest is in how do children cope and adapt to illness. And so this is really kind of the heart of it, and I would never presume parents know more about their own children than the physicians do. But it's just a question of our being able to listen to what you're saying. Now, there are some things that recurrently come up as issues for families. So it's very hard once you get a diagnosis for your child. Sometimes it's a relief because they've been going from doctor to doctor and no one can tell you what it is, and so having a name can be very helpful. But it's also very scary. And the truth is, parenting is a very humbling experience in general anyway. And if there were a manual for it, we would all be buying it, and that person would be a bestseller, right? So there's obviously not one way to parent. There's obviously, it's inherently, as I like to say, an acquired anxiety disorder that you immediately inherit the moment you have a child. So right there, you're already one notch up on the anxiety that you didn't have before. So, and then on top of that, when you have a child with a chronic illness, your anxieties go up double. So the issue is how, you can tolerate a fair amount of anxiety, so how do you manage your anxiety as parents? And then also, do you find places to kind of get resource help from other places to manage that anxiety? And does the anxiety or depression ever become so great that it's impairing your ability to parent? And then that is important because you'll see. So, one, your child will be diagnosed with whatever disease, but that disease does not define your child or you. So it's part of the fabric of their life and an up and down that they're going to have to experience, but you need to try not to make that their whole life. And currently I'm working with a lot of children with cancer. I worked with a lot of children with HIV, but and kids with cancer are incredibly resilient, as are most kids, frankly. So you just have to try to work at not defining your kid by whatever disease they have. So, and the second message is that, of course, you're very, very focused immediately on the life-threatening aspects of whatever disease, but the other part is that you really need to be paying attention to their psychological and emotional development at the same time. So, because when your child's well, those are going to turn out to be the most important things, how they're coping with their life once you're over the crisis. So you need to be keeping in mind, you can't forget the emotional, psychological pieces, even though these medical things are going on, and just to try to attend to them in the back of your mind all the time. Having a child with an illness means that some aspect of what you thought your life was going to be like is lost. But that's true even in healthy kids. Maybe you wanted a boy and you had a girl. So there are things that we all have these expectations on our kids, and it's important to try to take a minute to acknowledge it more consciously. So you can acknowledge that, maybe you wanted a kid that was going to be healthy and you didn't want to spend all your time in the hospital, or you weren't expecting your kid not to be able to play football, or you weren't expecting your kid not to be able to mow the lawn for you, or whatever the restrictions are. So having a sickness is a loss of a form, and it's important to take a little time to acknowledge that, and maybe even discuss it with your physician, that you're upset because you thought you were going to have this healthy kid. And I think that opens the dialogue between you and your physicians a little bit about that part of your life. And so, but a lot of parents don't want to admit it, but it is something to admit to yourself and think about. And if that becomes really overwhelming, it might be actually something to talk to someone about. Now, I don't know how many people have teams that actually have like social workers and psychologists or psychiatrists associated with them. So not very many. Okay, some. All right, but sometimes that might be another resource place to have these discussions if you're not comfortable having them with your primary care person. But all physicians should be trained in being able to have these conversations, and I spend a lot of my time training physicians to have those conversations. But They won't necessarily have them if you don't prompt them. So that's one of the things that, and they're going to come along the way. So first you're going to be grieving that you got this child with a diagnosis with whatever. And then things will go along, you'll get to a stable point, and then it might be that, they can't have children because they had some kind of chemotherapy, or and that's another time where you thought you were going to have grandchildren, or you thought you were going to have some other experience, and you might be grieving that. And I think you need to take time to acknowledge there are different losses along the way. Maybe your kid doesn't go to school regularly like everyone else, or so things that you thought were going to happen but aren't happening. You just want to take a minute to acknowledge that. Now, one of the areas that you get to are avoid the prince and princess syndrome. Anybody have an idea what that might be? Right. So exactly. So I think it's led by guilt with a capital G that every parent has when their kid is sick. And, whether it's you feel guilty because you passed on a gene that you didn't know you had, or but whatever it is, I think that's another thing to think about, because we all pass on all our genes. So you didn't mean to pass on that specific gene necessarily, and it's out of your control that you did pass it at this point. So you have to kind of work with that. But the guilt, carrying that guilt every single time the child, needs something, or that's detrimental for you all. So over the long haul. And the prince and princess syndrome is this issue of you feel so guilty that your kid is sick. And so, cut them a break. They don't have to do the chores the other child does. That's a really bad setup for everybody, okay? Because you don't have any expectations on your child. And in the back of your mind, maybe you're thinking, well, this kid isn't going to live that long, or, and why should we make them unhappy doing chores? But the truth is, you really don't know how long they're going to live. And I have a lot of experience with HIV kids. We didn't think they were going to live between, past 5 years old, and then all the drugs changed, and we got fantastic drugs, and now, they're in their 20s, but we didn't instill any rules on them when they were little. And I can tell you that trying to instill rules on 15-year-olds doesn't really work. On 20-year-olds, forget it. It's already kind of late. So you need to try to do the same parenting rules you would have done for your healthy child, because you need to expect they're going to make it. And so you're kind of cutting them short when you don't, when you don't put the rules on them. And it's really also very hard on the siblings. The siblings already carry a lot of, they get parentified because they're helping you with other things that you would be doing, but you're taking care of the sick child, and they feel left out, and they feel guilty that they're healthy, so they already have a lot on them. They don't need for the other child to have no rules on them, and it's really not good for the child anyway. Children actually all need limits. I hope there are no children in here hearing that, but the truth is they need something to push against, right? They need to learn that there are limits in the world. And when they go out in the real world, there are all kinds of limits, right? There are all sorts of rules. So you're not doing your children any favors by not letting them experience the rules along the way. So that's what I mean by prince and princess syndrome, and that's a big pitfall. There's one place that it especially happens in the hospital. So there's the hospitalizations, and then there's regular life. And some parents are pretty good about regular life, making their kids do stuff, but then they really feel really bad when the child has to go in the hospital. And that's another place where this kind of happens. And, you go to the gift store every time and they get a big gift. And so just think about what you're doing, the message you're giving, like it's really special to be sick. And, so just measure your own guilt. Think about that. Think about the fact that you're in the long run actually not helping your child by spoiling them that way. So, and the truth is, how do people really learn? They need a little adversity, right? That's what we're gating the amount of rules and adversity that children need as they grow up. We try to shelter them some, but they don't learn from none. So that's the reason, even regular kids. So really this is about having expectations on your child for every developmental stage and trying to focus on life skills, and I say not just academics. So it's very nice and It's nice to encourage your kids to do well in school, and it's nice to encourage them to play sports, but a lot of kids can't do those things for various reasons due to their illness. And what you want to do is get them to the highest level you can, but you also want to get them a sense of mastery. And mastery might not be getting A's in school. Mastery might be being an incredible photographer, or being able to play rap music, or being, so I think you have to be creative in thinking about what is your child good at, and what do they like to do, and what can they get good at. I had a blind kid be a Special Olympics bowler. He was really good at bowling, then he loved it, So it's different for every kid, and I tell this for parents of regular healthy kids, that it's important for mastery. So the other thing about why I say life skills. So I have a lot of parents come and their children are approaching the middle school or even high school, and it's clear that their cognitive abilities are somewhat limited, and that's not their strength in terms of they're not going to be getting A's, and it might be even a struggle to do their multiplication tables or whatever math is necessary, and they're sort of still focused on making sure their kid gets this math multiplication table. At that point, somewhere in the middle school to high school, it's more important to be able to make change from a $20 bill when you buy a loaf of bread, or being able to read a bus schedule and figuring out how to get on a bus and take a bus, and what do the times mean, and how do you subtract the time. There's some very practical, what I call, in Montessori they call it practical life, cleaning the table and doing, but there are things that you can help your child learn, and we don't focus enough on those in middle school and high school. We took away home ec, we took away shop. We took away all these things that people need to learn how to do. So I think that's left up to the parents now to actually have this practical life kind of curriculum. So just to think about that's actually something that's important. Okay, and remember that I think part of the goal is to help them develop into healthy and productive adults. And so you're trying to get to a point where you can let them go. Not every chronically ill kid is going to be able to be totally independent, but that's the goal. And so you have to have some times where you're a little uncomfortable. That's true for every parent, right? You're going to let them go to camp and cry a little bit and, separate from you and have that experience. Go to a 1-week camp the first year when you're 10, and maybe a 2-week camp when you're 11. So these are graded experiences, and we should be doing those for our kids all along the way anyway, both the healthy and the non-healthy SIBs. So I don't know if that's making all sense. So let me stop here. These are the first 5 points. Comments or questions or things that you'd like to ask about? All right, so the question is, how do you know when you're kind of moving from one developmental age to the next, and sort of how do you get advice about that? So 5, I think you could still be rewarded, because the longer you can go with good behavior and participating in it, the better it is, right? Because you want a track record. So we're looking for at least a few months of being able to follow the directions. But you're right that something like that does change over time, and you can either ask the pediatrician with you, what do you think about us graduating, or the nurses working with you, is it time yet? Or most hospitals have a child life person and or a social worker. You could talk about it with them. It doesn't need, and like you're saying, it shouldn't be abrupt. You make some changes, you don't want to change everything at once. But Part of this discussion is really to say that there are many more resources in the environment than you realize, and to try to reach out for those as well. So there are, at least every children's hospital has generally psychology involved in it, health psychologists trained in working with kids with medical illness, and we're just talking about needing guidance. So coming from a pediatric model, we call that anticipatory guidance. You go see the pediatrician and they tell you what the next stage is going to be. And so I think you can still use that, and it's hardly ever that you would get all the way to a child psychiatrist for that, but those people are available. And I want to try to destigmatize the use of mental health in these things. You wouldn't hesitate to go ask the pulmonologist, should I taper off the asthma meds now, or should I keep going? So in the same way, you should think about your child's development that way. So ask, the pediatrician, is it time yet, or should we keep going with this for a few more months and get it under his belt so he feels like he can master it himself? At some point, he's going to forget and not need it, so it'll sort of declare itself. But I don't know if that... Yeah, so I don't know if you could hear that. One of the things suggested, and that's a great idea, is when the issue is the child's getting a toy every time they go to the doctor and doing the procedure. So how can you kind of expand that, and so you can make it so that it's every 2 times you're going to get the toy, and then every 3 times you're going to get the toy, and sort of try to wean yourself off of that as they get a little older, and they're getting older also. So, okay. Yes? And treating them what?
Like royalty or like a princess or the art of distraction in a medical problem child is extremely important. I mean, my children are very young, born that. So the art of distraction is like our go-to. And it doesn't matter if we're tired or we're going through an LTI, what we're doing is very important. I mean, it's very much a part of it. So are you saying a princess at 4, or are you saying a princess at 14? What are you saying? What's your line?
So as you just described it, it is an art, and you're not always going to get it right. And the use of distraction is a fantastic technique. Distraction doesn't mean a toy every time. It could mean you get 10 minutes on the iPhone, or it could mean that you get, you have to blow on a pinwheel while you're getting your shot, because while you're blowing bubbles or something, because that doesn't, when you can't pay attention to both things at the same time, so that'll make this go faster. So I would not make equivalent distraction, which is a fantastic technique, and we use it all the way through. We use it as adults, when you're getting your blood drawn, you're thinking about something else if you don't want to look. So I don't make those equal. So that's a technique that works all the way through, and it's fantastic. I would never take that away. But the prince and princess piece of it, is that no rules. Like, Johnny doesn't have to clear the table because everybody else is, he's sick, and, everybody else can. Yeah, right. So, or making, yeah. That's the thing that, something. I literally have people feeding their 8-year-olds, in their mouth. So we do get these prince and princesses, and I just warn you that's a very dangerous situation to set up, because it's very hard to undo when they're fine and they're no longer royalty. So, all right, do I see more hands? So I only have one other slide, and really the rest is here for you and any kind of question you might have. Okay, so I really addressed this. In the best of circumstances, parenting is hard work, and that I suggest you ask for guidance about that the same way you would ask for guidance about other medical things. Apples don't fall far from trees. So that is to say that how your child is coping might actually end up being a reflection of how you're coping. So it means that you have to do a little self-examination. Right? So, because where do they learn what they're learning from you all? So if you are short-tempered and having outbursts, and they're short-tempered and having outbursts, you can't be that surprised that's where it's coming from. So And the truth is you have both strengths and weaknesses, and parenting is a lot, if you're consciously parenting, you're thinking all these things I don't want to do that my parents did. I don't want to be a parent like that. So, you're paying attention to that, but then you're not realizing what you are actually doing to your child, and so you just have to, and they have a way of reflecting it back to you. So just to say that you have to pay attention. And it's super important. It's actually not on here, I see, but it could be that a parent actually is not just stressed by having a sick kid, but has actually crossed over the line from stress to either anxiety or depression or panic attack. And that really, you have to reflect on, am I so irritable that I can't be in the room with my kid for 5 minutes without just having an explosion? Or is that something I need to go get help for separately? And, in order to be a better parent. So I guess I gave you slides that show parental anxiety is, very intense. It can lead you to believe that everything that's happening to the child is so magnified. So if you're following them around with the Purell, or you're not letting them go outside ever, or you're becoming so isolated for them because you're so afraid that any germ will get near your child, that's getting overly restrictive. Most of your physicians would not tell you to do that, and that's a sign that your anxiety is getting too great and is kind of interfering. So that's a time that you need to think about getting help for yourself, because there's definitely data that says parental anxiety, if you treat the parent's anxiety, the kid's anxiety will go down. So and we usually pick it up at the kid's side, so the kid is kind of anxious. All right, and we talked a little bit already about the siblings having needs too, and how can you attend to those, and trying to be fair, and how you treat your children is one of the places. Special time for them. It's not always possible, but just to keep in mind, don't use them as the babysitter, or try not to make them the parent that they're a kid too. That's important. So the truth is, even in the best of circumstances, you can't do it all, and it's extremely important to help use the community that's around you and find help in either your family or. So one of the things that I talked about is one of the single most research outcome that's been found on successful anything with chronic illness has to do with social support. So your bone marrow outcomes are going to be better if you have good social support, or your cancer treatment's going to go better if you have good social support. And so that means using people in order to help you. And so by that, if you extrapolate down, that's a form of social competence that people have in order to ask for help and realize that they need help, so they can reflect and say that they need that. So that's actually something you can teach children when it is that they should ask for help. And that will help them going forward in their whole life. So I always use this example. I had a pair of twins, 6-year-old twins, who were actually in the psychiatric hospital, and one was just incredibly irritable, and nobody wanted to go near that kid. And the other child was really friendly, and he was, would crawl and have you sit in his lap. He'd want to be sitting in your lap, and that was probably, a little overly friendly. But at the same time, all the nurses gravitated to the one friendly child, and everyone ignored the irritable child. So that just tells you that the social skills of a child can really make a difference in terms of how you get help. So it's important to work on your child's social skills and getting help. So, and then the last thing is really about enjoying your child. You're so worried about it, but this is called the gratitude therapy. And really, it has been shown to work that at the end of the day, if you pick 3 things and just remind yourself to be grateful about something each day, those people tend to feel better overall in general. So just a reminder, that's something very simple you can do. All right, questions?